Hey everyone, so today we're going to be going over the two brand new CGMs that just hit the market, the Lingo by Abbott and the Stelo by Dexcom. So if you don't know me, I'm Dr. Grady and I've been studying and practicing holistic medicine for about 10 years now. I also happen to be a type 1 diabetic, so I know and have experienced a lot of different things in relation to blood sugar regulation. And that's why I was so excited to see these over-the-counter CGMs coming to the market, because I've learned and been able to see so many different things by tracking my blood sugar. It's really helped me hone in on my diet and my lifestyle to really help achieve my health goals. And before this, it used to be very, very expensive for a non-diabetic to get their hands on a CGM to be able to monitor and track their blood sugar, to see how their blood sugar is reacting to different things and how it may be affecting their health. But first, let's see how these two compare on paper. Looking at this chart, you can see the wear period for both of these is about 2 weeks. The Stelo is a little bit longer at 15.5 days, whereas the Lingo is 14 days. Now the cost for these is pretty much the same. The Stelo, you have to buy two at once, and if you do it in a subscription, you can get it for $89. For just a one-time purchase, it's $99. Whereas the Lingo, you can buy one at a time for $49, or if you buy two, then it's going to be that $89. And then the warm-up period, so that's basically the period that after you insert it, it takes a while for you to start actually seeing numbers again. And the Stelo is 30 minutes, whereas the Lingo is 1 hour. That seems like a very trivial amount of time. However, when you are waiting for that extra 30 minutes, it seems like forever. But in the grand scheme of things, it's pretty much the same. And then the reading interval is a pretty big difference. The Stelo is 15 minutes every reading, whereas the Lingo is every single minute you get a new reading. And that's a big separator, which can be important depending on who you are and why you're using this, which we're going to go over a lot more later. And then another major difference is the range that they measure in. So the Stelo measures from 70 to 250 milligrams per deciliter, whereas the Lingo measures from 50 to 200. Now this is very important depending on how you're wanting to use this. If you are somebody that struggles with low blood sugar or reactive hypoglycemia, then you probably want to go towards the Lingo, which goes all the way down to 50. However, if you're diabetic, pre-diabetic, and you tend to get up into those higher ranges, well, you're probably going to end up going with the Stelo just based off the range, because you'll be able to see your blood sugar through that whole time. Now let's talk about how you set up and apply the CGM. Both apps are relatively easy and simple to set up. The Lingo, you're going to start off with the standard sign up, email, password, agreeing to the terms. Then you're going to enter in your standard health information like your height, weight, age, all those types of things. And then it'll also get into what are your goals for using this app, and then it'll ask you when you're eating, and this basically helps out with the setup for when you use the different features in the app. And then it also has optimal notifications, which if you've used a CGM in the past, you know this is awesome, because you can pick whether or not it alerts you, which is awesome, especially at nighttime, because if it's constantly waking up at nighttime, it gets really, really annoying. So this is kind of a good feature to have if you do want it to wake you up, or if you want to get some peaceful sleep and you're not needing that wake up because of an extreme low blood sugar or extreme high blood sugar. First, you're going to peel off the lid for the sensor, and then you're going to unscrew the lid for the applicator, and then you have to basically insert the sensor into the applicator. Once you do that, then all you got to do is place it on your arm and then push into your arm, and it will plunge directly in. And with both of these, neither of them hurt. I can tell you from experience. I've done many different sensors. I've had to check my blood sugar with the finger stick. I've had to poke myself with insulin needles. You don't hardly feel this at all. You literally just feel it hitting your skin, and that's it. I've had several patients that have used these, and I've helped them through it, and they're very nervous about the needles and all that stuff, and then when it happens, they're like, oh, that was it. So you don't need to be nervous about this part. Once the sensor's in, then it will ask you to scan the sensor with your phone, Once you do that, it'll all automatically pair up and you're pretty much ready to go. For the Stelo, you also have the standard login, email, all that good stuff. It also gives you a little bit of education on when and how to use it, making sure you're not wearing it in a MRI because it will mess it up, and making sure you're not changing medications based off of inflammation without consulting with your doctor. So what's nice about it in the Stelo is you can set your target range, whether you do a preset based off of pre-diabetic, diabetic, healthy, or you can set your own target range and customize it to your own liking. For the insertion of the Stelo, all you're going to do is screw off the cap. You place it where you want to on your arm, you hit the button, and it plunges it in itself. So the Stelo is a little bit better in this aspect. It's a little bit simpler. I mean, the Lingo is still pretty simple, but it's a little bit less steps and harder to mess up, if you will. For both of these, you want to make sure the adhesive sticks well, so you want to make sure you press down on the adhesive and sticks well to your skin. What's nice about the Stelo is it has an overpatch that you can put on top of it, which is going to help it stick better. It's really helpful because over those 15 days, that adhesive can wear off pretty easily and then becomes really easy to rip off. Plus, another pro tip is to make sure that when you're applying it, you apply it more towards the back part of your arm. If it's more towards the side here, it's really easy to brush up against something and it get ripped out real easy. So as far as insertion goes, I think Stelo is a little bit better here, a little bit less steps, plus it has the overpatch to prevent it from getting ripped out quite as easy. Also, because I know there's a lot of health nuts out there that are going to be watching this video, I also measured the electromagnetic frequencies that are being transmitted by these things to see how much exposure you are getting from these. And so I'll include that clip here. Alright, so I have my Wi-Fi turned off and my data turned off on my phone that I'm recording on. It's just Bluetooth enabled, and right now where I'm standing with it right next to my arm, the average EMFs that's coming out from this is between 3 and 4 microwatts per meter squared. So now we're going to put on the Dexcom Stelo, and then we'll retest once we connect it. Alright, now we got it on and it's transmitting. We're still averaging about 3 to 4 microwatts per meter squared. Alright, let's apply the Lingo sensor now. The warm-up for the Dexcom is done. We'll see if it's the same. Now we're averaging between 5 and 6. Alright, we got the Lingo put in. Let's see what it looks like. Still about 3 milliwatts per meter squared. So as you can see, both of them really don't have a noticeable increase in electromagnetic frequencies when you measure them. And I did this also over an extended period of time just to really monitor and see when it does send that signal to the phone, does it increase? And really I couldn't find a specific pattern that it would consistently go up to. So to me it was pretty negligible, which I was kind of surprised about, really. Now let's get into the real important part, which is accuracy. So what I did was I compared the readings from the CGMs to a finger stick, and I did that 18 different times, 12 of which I was steady, my blood sugar was steady going into that measurement, 6 of which I was either rising really fast or falling really fast. So I'll include some graphs here so you can visually see what I'm talking about. The first one here is the overall numbers, which to me was kind of hard to look at and it doesn't really tell you the full story. So I broke it down into basically the difference between the CGM reading and the fingerstick reading. And really overall they're pretty similar. If you've tracked your blood sugar before, you understand that the volatility and the accuracy of blood sugar checking can be very different, even within a finger stick. Finger sticks can sometimes be plus or minus 10 whole units. So the fact that most of these readings are within that range tells me that really there's not a major difference between these two. However, I did take the averages of each of them, and the Stelo had an average difference of 5.5, whereas the Lingo had an average distance or difference of 6.8. So the Stelo is a little bit more accurate in this test. Now when you're looking at the difference when you're rising or falling, it's going to be much greater because the CGM is measuring your interstitial fluid, so it's not measuring the actual blood, it's measuring the sugar in your tissues, whereas a finger stick is obviously measuring your blood. And so your blood is going to change before that interstitial fluid. So in general, the rule of thumb is that there's about a 5-minute difference between the blood and the interstitial fluid. So the difference when you're rising or falling is going to be much greater. Now if you remember, the Stelo had a 15-minute interval when you got the blood sugar reading, whereas the Lingo, it updates every minute. But when I would do these measurements, I would do them right after that Stelo would update. So that way there wasn't a big discrepancy in those two readings, which would obviously give the Lingo some advantage there. Now that being said, the Lingo still was more accurate. So I did an average again of the difference in the two, and the Stelo had a 13.2 average difference, whereas the Lingo was a 10 milligram per deciliter difference on average. And really in this category, the Lingo takes the cake, even if the accuracy wasn't as good, because you get that minute by minute update, and so you can really see that trend going up and coming down. This is especially important when you are making health decisions based around that spike, especially in that moment. So me as a type 1 diabetic, if I'm using this information to dose my insulin, that minute by minute update is a lot more important, because if I'm waiting 15 minutes and I'm making a decision 15 minutes or let's say 10 minutes from when I last saw an update, I can sometimes make a poor decision based off of that, because I'm thinking it's going up when it may actually start to flatline right after that last measurement. So again, depending on how you're using it, you may think one is better than the other. So now let's talk about some of the major downfalls with these CGMs. The first is that they don't have calibration, meaning you can't do a finger stick and then tell it, hey, this is what I actually am, and it will self-correct back down to where it should be, which is really important for me, because there's been times where my CGM has been way off, but I've been able to calibrate it with a finger stick, and then it gets right back into that good range there. I didn't really run into any issues with that in this test, but this was only one sensor length. I've had many sensors in the past where the calibration has been way off, but I've been able to do a finger stick and recalibrate it, and it get right back to where it's a lot more accurate. So the fact that I don't have the ability to calibrate it makes me worry about these, which is why I would suggest still having a finger stick glucose monitor on hand, so that way you can double check to make sure your sensor is accurate and you're not going off of false information. The next thing is the range. So we talked about how the Stelo is 70 to 250, whereas the Lingo is 50 to 200. Really, the perfect would probably be mixing the both, in that it would be 50 to 250. Because a limit of 200 is not going to be good for a pre-diabetic or diabetic patient. Oftentimes they can reach above those numbers, and so you're not getting those numbers and being able to see how your blood sugar is operating above that range. And a lowest reading of 70 is not going to cut it for people who struggle with low blood sugar, whether you're hyporeactive glycemic or a diabetic who struggles with low blood sugar. And a cutoff of 70 as a low blood sugar is not going to cut it for people who deal with low blood sugar symptoms, whether you're a reactive hypoglycemic or sometimes even healthy people go below 70. The next thing is compression lows. Compression lows are when the sensor is being compressed, like when you're sleeping, and that will cause a false reading. Typically it's going to be a compression low, so you have a false low blood sugar. And between the two, honestly, I noticed a lot more on the Lingo, or the severity of that false low would be a lot lower on the Lingo versus the Stelo. So if you're somebody that needs to know the nighttime blood sugars really well, the Lingo might not be the one for you. The last downside is the Lingo's adhesive. In my experience, the more adhesive, the better. They are very easy to rip off when you brush up against something, and when you've been wearing it for an extended period of time, like 15 or 14 days, the longer you're wearing it, the more that adhesive wears off. So it would make me feel better if that adhesive patch was bigger on the Lingo. Now the major upside with these CGMs versus a prescription CGM is that the notifications are more customizable, in the sense of you can silence them, so that way you're not being woken up constantly at night I know a lot of people, especially healthy people, run into that a lot when they get a lot of compression lows or false lows, and they check their blood sugar and it's fine, and so they're getting these constant lows throughout the night, and now they have poor sleep because of something that they're just trying to track their health with. To summarize what my final thoughts are, and to help you maybe choose what would be the best one for you, the things that are pretty much the same in level are pricing. Pricing is almost the same. It's really not worth splitting hairs on those things. The ease of use is very similar. They're very easy to use and set up and apply to your skin. I would say overall the app experience on the Lingo is a lot better. And really going through this process, I was kind of biased towards the Lingo, wanting it to be better because of the app experience. It's a little bit more intuitive, better things for tracking different diet, exercise, things like that, health tips and whatnot. So the Lingo app is a lot better. However, in my opinion, you shouldn't really be choosing your CGM based off of the app. You should be basing it off of how you're using it, accuracy of how and when you're using it. As far as the Stelo goes, it wins in the accuracy, especially in the steady state. And you also get a better high blood sugar because you get that extra 50 milligrams per deciliter on the range. And it's better for nighttime tracking because you don't get as much of those compression lows, at least in my experience. And so in my opinion, the Stelo is probably the best for the majority of people using over-the-counter CGMs. Healthy people, pre-diabetics, and type 2 diabetic. Now the Lingo wins in the rise and the fall accuracy. It's also better for people who struggle with low blood sugar symptoms, and you get that every minute update. This is really important for me because waiting 15 whole minutes to get that updated glucose can really cause me to overreact or underreact depending on my blood sugar. Because when it's rising or falling, I may take more insulin than I need or less insulin than I need, or decide to work out when I don't need to work out and stress my body out more. So for me, this is really important, but for the majority of people, this isn't as crucial. So I think the Lingo wins for people who deal with reactive hypoglycemia and type 1 diabetics. I know type 1 diabetics aren't supposed to use this. However, it does come down to price, because in reality, I can get this cheaper over the counter than I do my prescription CGMs. The major difference being it's not going to wake me up at night when my blood sugar crashes, and so you have to weigh the pros and cons there, because let's be honest, it's expensive to be a type 1 diabetic, and for me personally, this option is actually cheaper than my prescription option. That being said, you always want to make sure you're consulting your physician to make sure this is safe for you. I hope you got a lot of value out of this, and I hope you got some clarity on which one to go to if you are deciding to get a over-the-counter CGM. And please like and subscribe to this channel. And then of course, if I missed anything in this review that you want to know about or hear about in regards to my experience with these CGMs, please leave a comment below and I will be sure to answer them as soon as I see them. And remember, the better we take care of our bodies, the better our bodies will take care of us. So stay healthy.